Welcome to COVID-19 Nurse Panel, Prevention, Mitigation, and Response to the Epidemic. We have a 7-member panel, all of whom are nurses and who have contributed to the prevention, mitigation, and response to our current pandemic. Nurses have historically contributed significantly to protecting and providing care for infectious disease outbreaks, epidemics, and pandemics throughout history, globally and in the United States. During the Spanish flu pandemic, which was in 1918, nurses practiced across the continuum of care for the population, during which 675,000 people in the United States died. You may have seen in the news yesterday, on February 22nd, we just passed the 500,000 mark in the United States, and it is certainly not over yet. Public health teaches us that disease does not just suddenly appear, but instead occurs in a trajectory over time. What we see when it finally is in the clinical stage is much like a glacier showing its tip, when in fact a great deal of the disease process is not visible. The theory of the natural history of disease is represented on this slide, showing the stages of disease, and this would include COVID-19. There are many stages along the continuum at which we can intervene to prevent and minimize COVID, and nurses are working at all of those levels, primary, secondary, and tertiary, both in the US and again, globally. We can intervene when the population is susceptible using primary prevention, such as vaccination and education regarding face coverings. We can do secondary prevention through screening or COVID testing of pre-symptomatic and asymptomatic individuals, which minimizes transmission. We can treat early after identifying positives with treatments, like administering monoclonal antibodies or MAB, if we know about a person being positive in the early stages. Lastly, if a person gets very ill with COVID, we can provide care and treatment to minimize long-term effects and often save their lives. Our first panelist for today is Dr. Linda Mendonça, and I invite Linda to tell us about her contribution.
Thank you, Dr. Costello. So I found my niche in public health probably over 25 years ago as a school nurse, and did that for 25 or so years. And recently I've been teaching, and also I consult part-time as a state school nurse consultant at the Department of Health. I say part-time, but since probably the beginning of April with the pandemic, I have really bumped those hours up and have been working hard. Started with the governor's work stream on education, which included daycare, K through 12, and higher ed. My focus was on K through 12 as a school nurse, and having a voice at the table was really important. And I was happy that I had that opportunity to help with the planning of K through 12 schools reopening, looking at mitigation and strategies around what that was going to look like. I also sit currently, the work stream is kind of evolved once schools opened. So I currently still sit on the community mitigation meetings at the health department. And I also collaborate with the Education Operations Center, which was stood up back in August, and that composed of National Guard, the Department of Education, and the Department of Health, working collaboratively to ensure that schools had the technical support that they needed. So that's, a little bit of what I've done since last March around this pandemic. And again, I was really grateful to have the opportunity to share my school nurse expertise and have that voice at the table around school health, because as we know, educators in the schools don't have that expertise. And so I was able to be a part of that planning. So thank you.
Thank you so much, Linda.
Thank you.
Our next panelist is Denise Duarte. And Denise, I welcome you and ask that you introduce yourself and let us know what you have been contributing.
Thank you, Dr. Costello. My name is Denise Duarte. I am currently, among many other things, a school nurse in Tiverton, Rhode Island. I have been the benefiter of Linda Mendonca's sage advice many times and have called the Educational Operations Center and the Department of Health. And as you can imagine, during this pandemic, we have had a lot of work to do in the schools. One of my other hats I wear is since actually 2009, when the H1N1 epidemic came through, I have been a part of the Medical Reserve Corps here in Rhode Island. I was interested in that when the state put a call back in 2009 for nurses to help with the mass vaccinations that were going on in schools. So I wanted to do that. At the time, my children were younger and were school age, and I wanted to help in that way. So that's how I started. Between 2009 and last year, I didn't really do anything. And then all of a sudden, COVID appeared. So I re-upped and went back. So as part of the Medical Reserve Corps, it's a completely voluntary thing. And I have done lots of different things. As a nurse, you can do screening. My most recent thing has been doing testing in the communities. I usually go to Middletown and help with testing there. And now that vaccines are ramping up, I hope to be a part of the Medical Reserve Corps vaccination team. I am also doing community vaccinations. Last Saturday, for the next 8 Saturdays, actually, the town of Bristol is doing vaccinations there for their elderly population. So I started that, and it was my absolute honor to vaccinate a 107-year-old woman who came in walking on her own. She was great. So I love to give back in that way. So doing that. I'm also doing Tiverton on Thursday evening as well. So I think the Medical Reserve Corps is fabulous. It's a huge operation, and I'm grateful to be part of it. So thank you, Dr. Costello, for asking me to speak.
Thank you so much. And I know that both Denise and Linda do have other engagements, so I understand if you need to leave.
Thank you.
Next, we have Major Erin Abrahamson, and Erin is a part of the National Guard and will be telling us about her work.
Hi, my name is Erin Abrahamson, and I am a nurse with the Rhode Island Air National Guard. I was activated full-time last April for the COVID response, and that was to help with the design and development with the field hospitals. And they were not utilized in that first wave, but have been utilized this winter in the second wave, and have had over 600 patients between the convention center and Cranston. So that's been an important part of the state response. At the end of last April, the state and military started the congregate setting support team, in which I serve as a clinical lead on that team. And that team supports nursing homes, assisted livings, group homes, mental health facilities, and hospitals, as well as correctional facilities. So places where folks are living in congregate settings. And we serve as the single point of contact for support related to infection control, PPE testing, and staffing. We also are the singular field-based response that goes out to these facilities in outbreak and helps them. And that might be with education and training related to PPE, especially at the beginning of the pandemic. Increasing environmental controls within their facility, how to operationalize new guidance from the CDC or the state. So lots of different ways we help at the facilities themselves. we've supported over 188 facilities since April. And there's that's a picture of me there in my military uniform. When we visit facilities, we go in civilian attire. And the other picture is of me and my beautiful dad. And that's an important part of my story and my why. But my dad was a resident at one of these facilities. He had dementia and was at an assisted living facility. He contracted COVID and died in May. And so that was just a devastating loss. And, working in this setting, I felt that I could see how much it was devastating for staff too. And it really was an opportunity for me to support staff and work towards prevention. I did not feel alone in my grief. And I've just been thankful to have the skills and the position to try to affect change and prevent further outbreaks.
Thank you so much. Erin, I wonder if you would mind telling us a little bit about Major Joanne Barrett, your National Guard colleague, who is very busy doing important work at the vaccination center in Cranston right now.
Sure. So I've worked with Major Barrett for several years, and she has also been activated full-time, and her background within the National Guard is in immunization. So she's responsible for all the, really varied immunizations that people get when they're deployed all over the world. So that could be anthrax, yellow fever, typhoid. And so she has a lot of background understanding in getting a large amount of people through a vaccine line, and all the different requirements in preparation and documentation and safeguarding the health and welfare of all those involved. So she has been intimately involved in this process, and the Cranston, the vaccination center at the Cranston Field Hospital. And so they are currently able to process over 400 people an hour. They are the largest vaccination center we have in Rhode Island right now. So she's hard at work. They are about to add an evening shift. They're doing both Moderna and Pfizer. So she is engaged right now in prevention.
Very, very hard work. Thank you so much, Erin. The next speaker is Jacob Piguero. And Jacob, if you could describe your work with the Department of Health.
Yeah, hey, that's a picture of me quite a few years ago.
It is. I dug that up.
Thank you for that. So hey everyone, my name is Jacob and I'm a nurse on the COVID-19 unit at the Department of Health. So everyone that gets tested for COVID, those numbers get reported to the DOH. And specifically, the COVID positive results get reported to the case investigation unit, which is where I work at. So from there, a case investigator will interview the COVID positive person. We very often get confused by telemarketers, but trust me, we are not. We are the Department of Health. So basically the interview starts with, first of all, do you know that you have COVID? Often they do, but sometimes they don't. Then we go on to their signs and symptoms. And this is important because COVID, it takes 10 days for a healthy person to build a successful immune response. So from the time of symptom onset, 2 days before symptom onset until 10 days, you can potentially still spread the virus and infect others. And then we also want to know if they're immunocompromised, because with that, there's a question of prolonged viral shedding. So people that are immunocompromised for our purposes, they will get 20 days of isolation. And then we also educate them on what isolation is and the precautions that they should take. We are also usually the first point of education on what MAB therapy is. And we tell them, hey, it's a synthetic antibody that helps mitigate the symptoms and prevent severe disease so that people aren't taking so many healthcare resources and we plummet the system. So then we also go into their support needs while they isolate. Like being away from work for 10 days and even 20, like that's a lot to ask of somebody. And I definitely feel for that. So at the DOH, we offer them food assistance, even like within like a quick notice, if you tell us that you're hungry that same day, within a few hours, someone calls you, and then we give them like food, like literally from Stop and Shop. We also help with medication pickup. We even give them thermometers. We assist them with temporary housing. If they live in like a crowded situation where the person that has COVID really can't isolate successfully. And if they're homeless, they can go to the Wyndham Hotel in Warwick. I think that's what it's called. And honestly, I feel like I love this job. And even though I'm not at the front lines vaccinating, or at the hospital, or at the testing sites, my job is still honestly really important. I'm helping to mitigate COVID by educating patients, making sure that they safely isolate and not spread COVID. And I like this job because it shows that there's a body of people that like care for you when you go through these scary times.
Thank you so much, Jacob.
Thank you.
You're welcome.
Deb Borey, we have next. Oops, sorry, I think.
Oop. I morphed into
Here
Wendy.
you are. I know. Well, here you are. Deb Borey is at right now, as we speak, actually, at the Fort Citizen Field Hospital in Cranston. And she is working for Care New England. And Deb, if you could tell us a little bit about your contributions.
Hi, everybody. As Dr. Costello said, my name is Deb Borey. I'm in the MSN program for public population health. First, I want to say Erin's colleague, Major Barrett, is who vaccinated me, and she did a fabulous job. So I certainly vouch for her skills. I still do work at Fatima Hospital, and all at the last spring, at the beginning of COVID, I felt like we just weren't doing enough. I felt like we were constantly getting sicker and sicker patients, and they were not having good outcomes. And it was getting to be very difficult, very fast. So this winter, when the opportunity came to come here to the field hospital, I took a leave from Fatima and I jumped to come here because I thought it would be a great experience with my public health goal of being a public health nurse. And I'm not sorry for the choice. It has been a phenomenal experience to be here. One of the main reasons is because we actually get to see patients walk out the door on their own steam, and we cheer them. And it's just a fantastic feeling to know that we've done something to help them. So basically we get much more stable patients that come here. And I know there's been a lot of flack in the news about how it's a waste and so on and so forth. As Erin mentioned, we have had over 200 patients successfully discharged just from this site alone. That's over 200 beds that were freed up to take care of much sicker patients. And that's where the discord is. But here we can actually have some time with our patients. We can provide for their emotional needs and spend a little time to speak with them and to do more than just run in there and hang their antibiotics and hang their oh God, my God, it's slipping my mind. I'm sorry, because I'm at work and there's 100 things in the back of my mind. Their remdesivir and everything else. And we are here. We actually have time with our patients. And I just find that so rewarding and so satisfying. And it's a fantastic facility. It's negative pressure throughout the whole building. So the patients are able to get up and they're able to roam and just walk around. It's just been a great, great experience. I also work per diem for Lifespan in the Regeneron monoclonal antibody study. So I have had patients potentially that have had the MAB, but I don't know because it's a double-blind study. We are closing here next week. Thursday will be our last day. And at that point, I'm not really certain if I'm going to go back to Fatima. I may just stay with school and just stick with Lifespan, but it's been a pleasure to help out Dr. Costello. Thank you so much.
I really appreciate hearing about your experience, and thanks for all you've contributed. Our next speaker is Wendy Chicoine, and Wendy is from Providence Community Health Centers and also an adjunct at Rhode Island College. Wendy, if you could tell us a little bit about your contributions.
Sure. Hi, everybody. I'm Wendy Chicoine. As you can see, I am a graduate. Well, I have a public health nursing background. So similar, I think it was Deb who was just speaking, talking about going through the MSN program. So I am a graduate of the program from Rhode Island College. I also very much love public health. I found I found my passion when I did nursing 370 when I was doing my RN to BSN at Rhode Island College. So since then, you know, I've continued to pursue that path of public health. As Dr. Costello mentioned, I am the Associate Vice President of Clinical Operations and Education for Providence Community Health Centers. And very early on in the pandemic, I've been very fortunate that I am an internal incident command team member for our organization. So when COVID started very early on, you know, our team got together and we really kind of had to redesign how we delivered primary care in a pandemic world. And, you know, we utilized our nurses in a way that I don't think we ever had anticipated. So part of what I did was help develop triage protocols and how to triage patients because we were getting tons and tons and tons of calls, right? And so very early on, we had to kind of really assess those individuals, but also make sure that we're making sure that our staff are safe. So we really kind of had to redesign how we delivered care through telehealth as well. So I've been very fortunate to be involved with the assistance of developing those processes as well as infection control procedures within the organization. And I think one of the real proud moments I think for the organization was that we were the first walk up and drive up COVID testing site in the state of Rhode Island. So I was, again, very fortunate to be able to have had an opportunity to help write those procedures and how those particular processes would happen. So again, just utilizing the skill set in a really, in a very different way than I probably would have had expected that I would have. So I think it's a great opportunity, if anything. One of the other things that we are working on now is COVID vaccination. So we started vaccinating our staff. I've been heavily involved in the actual procedure development, but also administering vaccines as well. So again, very fortunate that I feel that although I'm working in an administrative role, I've been very actively involved in kind of on the ground. And I would say one other thing, I also, again, very fortunate to be part of Rhode Island Department of Health COVID vaccine subcommittee. So I've been able to, again, utilize my experience of working for Providence Community Health Centers. It's been 8 years now, and understanding the needs of the population to be able to contribute to this particular group. So overall, I feel like it's been an honor and a challenge, but in a great way. I feel professionally, I think it has really helped us develop our skill set in a much different way. So yeah, that's probably about it for me.
That's a lot, Wendy. Thank you so much.
Thanks. Thank you.
And last but certainly not least, Jocelyn de Gouvenaine, also a graduate of our program, who is one of our adjuncts, but also works at Rhode Island Hospital and has provided care for many patients with COVID. So thank you, Jocelyn, for talking with us about your experiences.
Thank you, Dr. Costello. Thank you, everyone. My name is Jocelyn de Gouvenaine. I'm one of the MSN week, both graduate and undergrad and graduate at Rhode Island College. So I currently working at Rhode Island Hospital in an acute care setting, even though I do have MSN and public health. This is where my heart is. My experience with COVID, I'm kind of, I feel like fortunate I'm able to serve the patient that I'm serving, as well as helping people in this country this country is really my adoptive country, and the citizen of this country has greatly contributed to my education. I perceive that as a way of giving them back for what they have invested in me. It has been a very great challenge for me, because at the beginning, we didn't have enough PPE. So I was able at some point to intervene because of my experience with public health and also my experience with working in Haiti with cholera during the earthquake, and basically had to mitigate and how to use basically function where resources are very scarce, how to utilize the system. So we were able to help the patient and saving life. And a way we were basically using both for primary, because by teaching the patient, at that time we were having family members when they are coming, we have to teach them how to make the mask. Nobody was sure exactly how far we will go in the teaching. Then the pandemic really hit. We have patients that are very sick. That not only we have to help taking care of this patient, and also the people were not able to come to visit their family members, which we produce a lot of anxiety for the patient as well as the family members. So we find a way to intervene, to have them face talk with an iPad with the family to at least to say hi, to see that their loved one is still alive. So that was, I was really feel humble and privileged to be able to serve in this regard, but it also was very sad from a point of view of public health to see how unprepared the whole system was to react to that pandemic, to basically maximize a way of saving lives. I learned a lot to this process. I'm hoping the government and the people who are involved in the leadership will also learn with me about how to better prepared.
That's a wonderful point. Thank you so much, Jocelyn.
Thank you.
Yeah, to better prepare to, I think we could really have intervened if we had really a good backbone of public health. I think we could have saved a lot of life. There's a lot of unnecessary death. Understanding the healthcare system is so fragmented. And as a public health person, even in education, when we teaching the family early, when we were discharging patients, there was no understanding about culture, about it's not appropriate to send people home to be quarantined, because it's really easy word to say it, but if we take the whole person, the context where they are living, in a lot of cases, a quarantine is really not appropriate. For example, if we have a family where we have 5, 6 people in a family, sometimes multiple generation, and they're sharing the bathroom, they're sharing the room, we can teach all we want. We could ask them to basically quarantine, but it's just like hand-on is not going to happen. The environment doesn't produce it. Unable to witness how the minority population get affected. And that whole experience, I think, really bring it home to me, and to see, I always know that already, but the importance of a public health as a backbone of the society, really. Without public health, really, there is no acute care, because it's almost like you feel the whole system just collapse. And right. We don't have a buffer when it collapsed to basically pop that up. It just landed up in the ground.
It's true. Thank you so much, Jocelyn.
Yeah.
So as Jocelyn said, nurses were at the bedside early on when there was no PPE, and we have record of, and probably there are many more, over 3,400 healthcare workers who have died, 32% of those who were nurses. And frontline workers have been recognized for their contributions to the pandemic this year as Time Magazine's Guardian of the Year, and in the coin flipping at the Super Bowl. And nurses have been a big part of the effort and will continue to contribute across the continuum of care in the future. And as Jocelyn said, for which we will hopefully be much better prepared. Thank you for your attention. And to paraphrase Dr. Jeremy Rose, who wrote an op-ed for the Washington Post, Healthcare workers ask that you don't thank us by clanging pans or clapping, by bringing food and wine, by sending flowers or any other demonstrations of appreciation. Thank, excuse me, thank healthcare workers by wearing face coverings, by maintaining social distance, by getting vaccinated, by getting tested. Be a good citizen and consider others who might be more vulnerable in the population than you are. Thank you so much and be safe.